America is getting older. The Census Bureau reported today that there are now nearly 2 million people in this country in their 90s. That number has tripled since 1980. We asked Dr. Jon LaPook to give us some insight into why we're living longer and what that means.
99-year-old Sidney Cronish may move a little slowly these days, but this retired economics professor still has a lot to say.
I read, I study, I write, I talk, and people sometimes listen.
Better medical care accounts for much of the boom in those living over 90. In fact, by the year 2050, it's projected to grow from today's 1.9 million to 9 million. Dr. Claudia Cowas has been studying this age group.
Much of that extension has come at a cost. We've extended the quantity of life, but now we need to extend the quality of life.
Most of those who live into their 90s outlive their resources, with average income under $15,000. One fear in the coming decades: soaring medical costs. Currently, Alzheimer's affects 5.4 million people. By 2050, that may grow to 16 million. The medical cost will go from $183 billion now to $1.1 trillion. Arlene Richmond runs Kitay House, a senior living center. She says the 90 and overs do best when they're fully engaged.
2, 1, 2, 3. Being part of a community changes their world. They have people who share their passions. They have a reason to get up in the morning. They continue to be the movers and shakers that they were.
Sidney Cronish has his own secret to a longer life: family.
I was born into a wonderful family, and my wife was special. As she put it, I chased her until she caught me.
And Scott, women make up 3/4 of this elderly population.
John, I wonder, can our healthcare system cope with this many older people?
Absolutely not, Scott. And even though it can be such a blessing, my own dad is 93 years old, economists simply don't know where the extra money is going to come from. The current healthcare bill per year in America is $2.5 trillion.
John, thanks very much.